Hello. I'm so pleased to be here. My name is Colleen Heflin. I'm a professor at Syracuse University, and together with my colleague, Madonna Harrington-Meyer, we just released a book, Food for Thought, Understanding Older Adult Food Insecurity, and I'm going to share a few takeaways with you briefly today. So while food insecurity among households with children often makes the headlines, a quieter issue that receives much less attention is food insecurity among those 60 and older. For some older adults, these problems represent the culmination of decades of hard living. For others, they represent a decline in the economic security that accompanies middle or old age. For some, these issues are offset by the resources rich neighborhood environments provide, while for others, they're exacerbated by the paucity of local programs aimed at reducing food insecurity among older adults. Take, for example, the case of Alex, age 65 with low food insecurity, who was one of 63 people that my co-author and I interviewed for our book. Alex and his wife never gave food insecurity a thought as they raised their 4 children and welcomed 7 grandchildren into their lives. Alex had steady manufacturing work, and his wife mostly stayed home with the children. They had plenty of food. Alex used a small inheritance to purchase their current mobile home and save for retirement. His family trajectory began to change when he was injured while lifting heavy equipment at work. He was told he was eligible for Social Security disability benefits, but the paperwork and rules were too formidable and he never received it. By age 58, he lost his job, was in poor health, and could not find work. He delivered pizzas for 2 years and spent down his savings. Out of options, he retired at age 62, receiving the lower Social Security payout so that he could have at least $16,000 a year to live on. He told us, sometimes when I look in the fridge and it's pretty bare, I'm going, I worked for 50 years and this is how life's gonna end. Unfortunately, Alex is not alone. Among households containing adults 60 and older nationwide in 2023, 9.2% were classified as food insecure according to the USDA definition, and this proportion grows to 20% when we focus on adults living below 185% of the poverty line. I chose to write a book that focuses on food insecurity because food insecurity connects to nearly all other dimensions of well-being, as those in this room clearly know. The retirement system in the United States results in the highest level of old age poverty among the richest countries in the world and exacerbates gender and racial wealth inequities. While younger people tend to move from mishap to windfall, older adults, typically constrained by fixed incomes, tend to continuously live on the edge of mishap. In old age, income stability, which may appear to be a blessing, may at times be a curse. Even with Social Security, many older adults' fixed incomes do not cover all the necessities or provide much leeway to adapt to changes in food prices. From medical expenses to phone expenses, we heard how it's difficult to stretch a modest fixed income across an entire month or across all the necessary household expenses. When many older adults don't have enough money to meet all their essential needs, food often ranks below housing and energy needs, and it competes with medical expenses and transportation, personal and cleaning expenses, and phone and internet coverage. However, while financial factors play a large role, non-financial factors also shape the risk of food insecurity in old age, notably poor physical, cognitive, and mental health, lack of access to healthy food, and transportation challenges. And unfortunately, the current policy response to old age food insecurity in America is complex, costly, and not effective enough. As you know, SNAP is designed to address the economic roots of food insecurity, In 2023, 9.7% of the US population age 16 and above participated in SNAP each month, and nearly 1 in 3 SNAP households contains an older adult. Despite these high numbers, just over half, 55% of older adults who are eligible actually receive SNAP, compared to 88% of all adults and nearly 100% of children, according to USDA's measurement. So why is SNAP participation among older adults so low? Well, first, the administrative burden associated with signing up and recertifying for SNAP, which is a problem for many, is more likely to be a barrier to participation for older adults and those with disabilities. That is, the process can feel more confusing and burdensome due to low levels of computer literacy and education levels, and greater difficulties with transportation, mobility, and sometimes sight, hearing, and cognitive functioning. Second, for some older adults, SNAP benefits may be difficult to redeem due to barriers in getting to food retailers that accept the benefits, and the benefit level itself may be too low to make a difference. For others, the type of food covered by SNAP, stable items designed to be cooked and eaten at home, may be too heavy to carry, time-consuming to cook, and difficult to adjust to portions suitable for a person living alone. Most older adults on SNAP live alone. To increase the number of older adults on SNAP, we suggest increasing the minimum SNAP benefit amounts and indexing benefits to local food costs, expanding the restaurant meal program, improving access to home delivery, removing requirements for states to offset costs when adopting the standard medical deduction, and expanding state participation in the Elderly Simplified Reporting Program, which New York does a great job of adopting already. But while SNAP is designed to address the economic roots of food insecurity, it follows the community-based programs to address the problems related to physical health, mental health, access to nutrition and transportation. And here I'm talking about group meal programs, home-delivered meals, and sources of free groceries. In talking to our respondents, we found 2 problems with community-based programs were consistently mentioned. First, the quantity and quality of food, both meals and groceries, varied markedly by where one lived. And the food available was sometimes of poor nutritional quality. Given that much community-based food sources often rely on volunteers and donations, and let's be honest, sometimes food waste, maybe this shouldn't be a surprise. You get what we pay for, and nutritious food is expensive. Secondly, physical, cognitive, and transportation limitations associated with being older often impede participation. Many food banks or congregate meal programs are only open for short windows, which make it hard for people to get to if they have transportation and mobility limitations to receive the assistance they need. And small fees are common for participation in home-delivered meals and congregate dining. And these were described as a barrier to participation among many of our participants. As a whole, older adults are more likely to receive SNAP than community food programs. While nearly 1 in 2 participate in SNAP, nationally, less than 3% report receiving free meals and less than 7% free groceries. We need to increase the availability of nutritious food and provide easier access for people with health, cognitive, and transportation problems. Making sure lower-income older adults have access to healthy and nutritious food will reap many rewards, including improved physical, mental, and cognitive well-being, improved social integration with declines in loneliness and social isolation, decreased healthcare costs linked to better diet and medical compliance, and better options for living longer in the community and delaying the transition to residential care. The United States sits on the edge of a precipice with regards to older adult food insecurity. Without an increase in the surveillance of food insecurity within the healthcare sector, and a substantive policy changes to address the needs of older adults, stories like Alex's that I mentioned at the beginning are going to become increasingly familiar. Publicly funded healthcare costs will continue to skyrocket as the health consequences of a lack of access to affordable and nutritious food exacerbates the cost and treatment of chronic conditions such as diabetes, health disease, and cognitive decline. And the ability for older adults to live independently within the community will be diminished if we as a society do not figure out how to make it easier for older adults to access nutritious food in their homes. The safety net in the United States is nearly 100 years old, and it's not designed for older adults. It's time for us to rethink our approach to addressing older adult food insecurity. And it's my hope that our book can provide some food for thought as we think about what that change should look like. Thank you.